Exhausted and stressed, and yet determined to care for the sickest of the sick. I'm talking about the bedside nurses and doctors treating our kids suffering from COVID. This morning, they're revealing what it's like inside the pediatric intensive care unit over at Norton Children's Hospital, a place most of us have never been. When you ask how she's doing, Kristen McGuigno is quick to smile.
I'm good, tired, but good.
But the reality,
it's all starting to kind of wear on us a little bit for sure,
is one felt through the entire hospital here at Norton Children's.
The nurses and the respiratory therapists really have worked hard the whole time. They've gone to help the adult hospitals when they were seeing the surge. And now that we are having the surge, they're putting in their extra time here too. So it has been challenging to just keep the energy up.
The Delta variant's hitting children harder than ever.
The kids are getting pretty sick very quickly.
Overwhelming hospitals across Kentuckiana.
The volume that we're seeing right now is what's concerning for all of us.
This week, Norton's treated at least 25 kids with the virus, more than it's ever seen at one time, the majority between the ages of 10 and 17.
Many of them were vaccine eligible, which makes it even harder to really reconcile.
And it always has been difficult to see kids in situations where they shouldn't have been from people around them or choices people around them made, but we have to leave that up to each parent, unfortunately, to make that decision of what's best for them and their child. We can't make that choice. We can just encourage them with what we know and our knowledge and our expertise.
And with this most recent surge, 7 are in the ICU.
We've had some kids on the ventilator for several weeks already.
And none have been able to come off.
If you've never seen a kid on a ventilator sick from a respiratory virus or from the flu, you may not feel the way or have the fear that we have about it. They have fluids hooked up to them and maybe other sedation meds. They usually have a tube in their nose or in their mouth that goes down into their stomach. They obviously have the tape all over the face. I think that's the most difficult thing for parents a lot.
If it's not COVID, it's likely RSV, which not only hit early this year, but also in record numbers. Staff have never had to deal with both at the same time.
I mean, RSV usually rocks our world all the time anyways in the winter. So when you throw that in with COVID, it just really is putting everybody on their toes, I think.